So this is Chubbs, my English bulldog, who really loved toys. And then in spring of 2021, he caught a ball, he bled a little, and then stopped eating the next day. And that's when we realized there was a mass growing from the roof of his mouth and took him to the University of ER, where he was admitted for contrast-enhanced CT and tissue sampling. So being in radiology, I had to ask the vet to share Chubb's CT while we waited for the formal vet radiology and pathology reports. And looking at the CT, I knew it was an aggressive tumor with surrounding osteolysis and right nasal invasion. And the pathology report returned with the diagnosis of chondroblastic osteosarcoma. So having 3D printed for human treatment planning, I wanted to do the same for Chubb's. So Chubb's CT imaging series included non-contrast and self-tissue kernel or reconstruction algorithm, as well as bone kernel and long kernel, where both the bone and the long kernel sharpens the images, but really increases background noise and imaging artifacts. And there are also a series of different contrast phases in self-tissue kernel, including arterial, venous, and delayed face imaging, where the heterogeneously enhancing tumor was better delineated on the venous face imaging series. So I imported the venous face series with the 1 millimeter slice thickness to segment his cranium, tumor, and also his mandible for print. I printed the model on a Stratasys J750 PolyJet printer with the skull in white and tumor in magenta. The model actually altered the vet's initial plan for a wide margin resection to a narrow margin resection, followed by curative intent radiation therapy due to insufficient maxillary bone tissue with Chubb's finger brachiocephalid breed, which would have led to nasal collapse and other complications. So the vet also sterilized the model to serve as an intraop reference during the tumor resection. Chubbs did really well and was in remission for well over a year. So since then, I've continued